this one what you call Zoom class to make it more than 100. But before starting any technical subject, see, one thing we must understand, study and medical science is a very vast subject. In this vast subject, there are various pathologies and differential diagnosis, right? Pathological diagnosis and differential diagnosis is very important part of the treatment procedure, right? Now, the symptoms of many diseases are seen. For example, let us take cervical radiculopathy, pain coming from cervical region to the hand. What do you see? Pain is high or not? High. But on the other sense, if you see the patient is sweating and all, what will you understand? It is MI. So, to determine a subject diagnosis of a patient, you have to be very specific. A patient may come and say, I'm having a referral pain. There was a person called Rajesh. He was saying, sir, I'm having this pain and little bit chest pain. The MD medicine doctor was sitting next to me. I said him, sir, let us observe him for 30 minutes. Within next 20 minutes, we came to a conclusion without any additional symptom that he was having cardiac arrest, myocardial infarction. So, always we should not be conclusive with what? The symptoms of the pain. The symptoms of the pain may lead to different diseases. There are many kinds of sciatica pain. For example, slip disc at L4, L5 region. This leads to different pathway. I have given you the slides today. Dermatome and myotome of L4, L5 region, L5S1 region. Then tumor. Then spinal bifida. Then piriformis syndrome. So you will see there are various symptoms of the disease which determines the what? Problem of the patient. So in understanding this, we must understand today I had a very severe headache before the classroom. I inserted few points and I have taken some. It was such a severe headache, I don't know how it came all of a sudden. And within 25-30 minutes, it subsided and I am back on duty. Now, what is the best remedy during this treatment, you see? I am taking the class. Before 20 minutes, I was not even in a position to sit on my chair. So that part all we must understand. And there are two things in every pain syndrome we must understand. What are they? Diagnosis and differential diagnosis. Can anyone tell me what is the difference between diagnosis and differential diagnosis? Anyone?
So differential diagnosis is having 2 to 3 options. Diagnosis is when you confirm that it is like example, if you have lower back pain and you say that it is lumbar spondylosis, that is diagnosis. But along with lumbar spondylosis, if you write 3 4 things like piriformis syndrome and putting a question mark beside that, that would be differential diagnosis.
Madam, can you tell me the difference between what is the major difference between piriformis syndrome and slip L5S1 nerve compression?
Yes.
What is the major difference?
I'm not sure. It may also be wrong. In alpha S1 issue, the nerve compresses there itself, and in piriformis syndrome, at piriformis muscle level, the nerve compression would be there.
So what is the main difference? How will you classify it as piriformis syndrome or?
I don't know, sir.
Madam, you have answered the question. The question itself is in the answer. The answer is that in piriformis syndrome, which is called sciatica pain, I'm sorry, huh? In sciatica pain, what do you see? If there is a problem in the disc compressing the nerve at L5S1, there is a compression in the gluteus, that is in the lower part of the muscles where you are sitting. Then it is not piriformis syndrome. It is because of the disc lesion. This is the problem of the disc. The patient is having sciatica pain. Clear? But on the other hand, if it is because of any other origin, the nerve compression is there, then the piriformis muscle is pressing the nerve, because majorly in male people you put the purse in the back of your pants. So it compresses the piriformis muscle. As a result, what happens? Because the nerve is compressed, the sciatica nerve is irritated and you have a severe pain. So, what is the major difference between piriformis syndrome and sciatica pain? In one, disc lesion is there. Otherwise, in other one, there is no disc lesion. Am I clear? Am I clear to all of you?
Yes, sir.
Yes, Alpha.
Yes,
In
yes.
piriformis syndrome, there is no problem in the disc, right? It is a compression of the piriformis muscle. But because of the nerve compressing at L5S1 level, there is a compression. कौन है? Yes? कौन है?
208 patient or lady.
208.
Patient, lady. Old lady. Pain.
208 having more pain.
Pain or something.
Okay. You remain in pharmacy, huh?
No.
After 30 minutes, I go to pharmacy. Now you will see in 208, there is a patient whose lady is having severe pain. She is the attendant of the patient. Now I'll subside the pain without inserting any painkillers. That is how I have learned, because I get the most, in your clinic you get simple cases, but in my clinic I get most critical cases because we work in palliative care also. So people come to us in the last stage. What people come? People come to us in the last stage of the disease. And then this is how we have to manage the patient. So now we can understand pain has various syndromes, various pathologies, various understanding, and in many cases it becomes non-recoverable situation. Today you treated the pain, tomorrow again it has come because the soft tissue has not recovered, the muscles have not been strengthened. There are various reasons by which the patient has not recovered. So just putting needles, that is what I was amazed. Some people coming from Malaysia, some coming from here. When I went to Indonesia, France, they are very fascinated for this. I met the direct disciple of Mr. Tan. They used to say, sir, today we insert the needle, the pain is gone, but tomorrow again it comes. What is the reason? I asked him, what did you do to recover the pain? So we inserted the needle. So do you think only insert the needle in this peripheral area will recover the pain for a longer time? Will it solve the pathology of the disease? Do you think such a strong problem which she is facing from years can be, relief is the most important part, but recovery is the essential part of the disease. There are two things, relief and recovery. Patient comes to you for first for relief, second comes for recovery. So Tung method, 10 method, they give very good relief. But for recovery, you have to apply various methods, protocols, different pathways by which you can recover a most difficult and critical situation. Am I clear to you for this part? So now you may have a question that, so how to treat low back pain? See, there are large number of sciatica syndromes. Today I have given you some slides in the group. Did I give you or not? So that you can understand by these slides that there are various symptoms. There are various understandings and pathologies of the disease. What is the difference between other hospital and this hospital? Because it is integrated with allopathic hospital along with what? Integrated care. So now, because of this integration of acupuncture and other things, patients get a good recovery. We try to reduce as much as medicine we can, and you can see a 85-year-old man also is getting good recovery. And I'm sure very shortly the 85-year-old man can start walking. I'm going to make him walk very shortly in few days. The person is of 85 years, whose 60% of the brain is damaged, whose video you have seen has started recovery. Now, how many of you people can believe that a very beautiful recovery can happen in couple of sessions in paralysis patient? How many of you can believe? How many of you in the class can believe a patient in 5 or 6 minutes can show a beautiful recovery up to 60% in few sessions?
Sir, I believe.
May I know who's speaking?
Achal Sharma, sir. Pranam, sir.
Kaun? Achal?
Ji, sir, ji.
No, Achal is my very old student. She is from Lucknow.
Pranam, sir.
Pranam, beta. How are you? How is your health?
Better, sir.
You have taken the medicines for pneumonia?
Yes, sir.
How are you feeling now?
Better, sir.
You are taking antibiotics? You are the same Achal Sharma, na?
Yes, sir. Yes, same.
How are you feeling with the antibiotics? You are feeling better?
Yes, sir. Better.
Your voice is also getting better. After a short
Yes,
while, you will
sir.
recover fully and you
Thank
join your
you.
job back.
Yes, sir. Thank you, sir. Yes, sir.
Now, the most important classification is the foundation of the subject. What is the foundation of the subject? You want to treat pain as a symptom or pain as a disease? If you treat pain as a symptom, you apply any method, pain will recover. Pain will get relief. But if you recover, you want to treat as a disease, then what will happen? You have to work with various methodologies to overcome that situation for which the pain has occurred in the patient. During this process, you will come lot of difficulties. For example, when we treat with a patient of spinal cord injury, we overcome lot of problems, lung problems, right? We overcome bed sores, we overcome different type of infections, especially urine infections. Then most difficult thing, one thing I want to teach you in this pain management and bedridden patient is embolism. Someone is speaking. If you speak, how will I speak? Kairunisa. Yeah, mic be muted. See, what was I saying? What was my last sentence?
Embolism.
Embolism, yes. See, in most of the patients who are bedridden, spinal cord injury or because of back pain and all, they develop an embolism, that is clotting in the vein, right? It in the lower limbs or anywhere. Because of this clotting, now if you mobilize the patient, you move the patient, right? For example, the patient is bedridden for 5 months in the bed because of pain or paralysis, right? The most difficult thing which we do here is that we don't check the color Doppler test of the lower limbs, right? Or sometimes the physicians forget to give the tablet called aspirin or blood thinners or anti-clotting agent, right? Anti-clotting agent or blood thinners. So during 6 months, the patient is bedridden. As a result, what happens? Tell me. It is a embolism. Now, if you move the patient in embolism, what will happen? The emboli will break down and it may go to the heart or it may go to the brain. If it goes to the heart, the patient will immediately die. So in any long-term patient who's in the bedridden, first line of advice is what? We have to go for color Doppler test. What we have to go for?
Test.
Color
Color Doppler.
test. In color Doppler, we have to find two things, deep vein and superficial vein. Am I clear?
So please, can they be writing the terms, the terminology so that we can get the right spelling and pronunciations?
Color Doppler test. C-O-L-O-U-R. Color Doppler, D-O-P-L-E-R. Color Doppler test. Lower limbs, deep veins and superficial veins, in which you will find whether there is embolism or there is no embolism. These are some foundations you must understand before you start treating a subject. Generally, what happens in acupuncture, people don't discuss about all these fundamental things. They straight away go and say this pain, back pain, put, tick, 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 tick. Pain goes, ah, hurrah, my pain is gone. Praise the Lord, hallelujah. After some time, you will see patient has gone into paralysis. Why? Because you have treated the pain. By chance, the patient would have had bone TB or cocks in the bone, what is called infective bone etiology. Then what will happen? So, three things always matters in a patient. What are the three things in the patient? History, yeah, हिस्ट्री आप ये मेरी तरफ से ले जाइए, ये ले जाइए, ये आप खाइए. History, progression of the disease, symptoms of the disease, previous symptoms, present symptoms, and then you may be asked which type of disease the patient is suffering. After coming to the conclusion that this is the type of the disease, then what you have to do? Then you may conclude with the help of investigation. Investigation means what? The type of investigation. Once the investigation is done, we'll come to know that this diagnosis is confirmed. After the diagnosis is confirmed, it becomes a part of the pain, becomes the part of the Dr. Subhash, mute your mic. See all your family conversation, husband and wife is fighting and we are hearing it. What was I saying?
Investigation, diagnosis.
Yeah. After, see, before the pain was a symptom. After you conclude all the history, symptoms, everything, you come to a conclusion that this might be of this disease, right? According to your conclusion,
Oh, please.
Dr. Subhash, please mute your mic. Then you may go with the diagnosis of the disease. After the diagnosis is confirmed, then you may decide what kind of treatment is best suitable for the patient. Without diagnosis of the patient, the disease is what? Not? It's just a symptomatic relief. Without diagnosis, tongue, what you say, pulse, tongue, all these are symptomatic diagnosis. They tell you about the symptoms. But exact pathology of the disease comes from the medical parameters. Once you have the exact medical parameters, then you come to know this is this type of disease. Once you understand this type of disease is there, then you can go with the diagnosis of the patient and then you can confirm this is the disease and this is the treatment. This is how the medical world follows everywhere in the where? Whole world. Am I clear? Anywhere, anyone is having any doubt, please come up with your doubts. Anyone is having any doubt, please come up.
Hello, sir.
Yes, please tell me.
Can you repeat this protocol of the diagnosis? This history.
See, first is the patient will come and tell you about his complaints, right? I'm having back pain, this, right? present symptoms, burning sensation, tingling sensation, right?
Okay.
Clear? So first is the symptom of the patient. Am I right?
Yes.
Then you will go with a clinical examination as per the symptom. For example, he is having low back pain, sciatica pain. We'll go with the testing of side leg rise and other clinical signals to confirm which kind of disease he is having. Whether he is having slip disc or whether he is having piriformis syndrome. Previously also I said piriformis syndrome and slip disc has a major difference. In slip disc, sciatica pain, the pain in the gluteus is high because of the nerve compression. But in piriformis syndrome, if you call it piriformis syndrome, then there is no discretion. It is just compression of the piriformis. The entire treatment protocol of both the disease is different. The insertion of the needle, the treatment protocol is totally different. On one side, you have to release the piriformis muscle. On the other side, if it is a disc lesion, you have to work with the disc lesion of the patient. Number one. Number two, the clinical signs of the disease will explain you that this may be a disease. Now, once you conclude that it may be a slip disc, go in Google and see what are the different symptoms of this type of disease which you conclude. You have concluded that this may be a tumor. Okay. Which kind of tumor? This tumor. Okay. Now go in Google and see what are the symptoms of this tumor. Once you see the symptoms are similar to it, then you see what are the investigations required. Once you go with the investigation and you find out that this is a particular disease, then you may decide which is the best treatment for the patient. This is called documentary evidence for the diagnosis of the patient. And this is called diagnosis. One is clinical diagnosis, one is documentary diagnosis. Documentary diagnosis means pathological and radiological and other scans, right? As well as clinical means the clinical science. Clinical science always explains you about the radiological science. That there are 2000 tests. You cannot write 2000 tests to a patient. You have to write a limited number of tests, right? To write a limited number of tests, what you have to do? You have to what? Understand which kind of disease is it.
Conclude.
And to confirm your doubt,
Okay.
you write those investigations, and under those investigations, you confirm that this is the disease of the patient. As per the disease of the patient, now you confirm what is the cause of the pain, and as per that cause of the pain, you can treat the patient. This is the number one. Number two thing, the patient may not believe you that already has done lot of investigation, lot of things, right? Before coming to you. You are not the first physician to treat the patient. Am I correct? Patient comes to you in a very lateral stage, right? So see his documents very much properly, and then you may conclude that what is the disease, what was the treatment done, whether the existing symptoms what you see are primary or secondary. Because of the medicines which he has consumed, the primary symptoms are absent. For example, low back pain is absent because he has been consuming pregabalin, painkillers for a longer time. So the muscles have become what? Stable, saturated, or whatever you call, weak or anything. As a result, what happens? The primary symptoms are absent. But secondary symptoms you may see. What are the secondary symptoms? The secondary symptoms are tingling, pulling of the nerve, burning sensation. So all these are called the sciatica symptoms. Now you have two reasons to understand it is a sciatica with the clinical investigation. After clinical test in YouTube, if you say write clinical test of slip disc or sciatica pain, you will see number of investigations. Go to YouTube and see the clinical investigation of sciatica pain. When you go into YouTube and see the clinical investigation of sciatica pain and you are confirmed it is sciatica pain, please do not say that it is sciatica pain also. This may be any other reason of the pain. In 90% case, it may be sleep disk, but in 10% of the patient, it may not be a sleep disk. It may be a cancerous disease. So what you have to do? You have to,
Biopsy.
what you have to do, madam? Yes, madam.
Investigation. Investigations go.
Which kind of investigation will you refer?
Is it biopsy of that?
Madam, biopsy is taken in which region? When is biopsy taken?
It's very difficult.
No, when is biopsy taken, madam?
Biopsy is taken as the final conclusion of the cancer and the stage.
See, the primary investigation is MRI. And in MRI, we always write if there is a typical symptom, we always write in bracket contrast normal,
Okay.
right? MRI, LS spine, whole spine screening, right? We wrote as MRI, LS spine, whole spine screening. Then we write normal, right? Contrast if required. What we write? Contrast if required. If there is a contrast and we find that there is some lesions like tumor and all,
Okay.
then we go for two type of investigation. What are they? It is called FNAC. FNAC and biopsy and tumor grading. So in 99% patient, you don't find this problem, but you do not know who is your patient who is having this disease. You cannot say 99% patient is having pain. It is a simple low back pain. You keep putting needles, and meanwhile the cancer is spreading in metastatic stage. And at the end of the day, you come to know, oh, it's a cancerous class disease. Then what will you do? You are in a big problem. Am I right or wrong?
Yeah. Yes.
So, diagnosis comes from the symptoms and history of the patient. There are two things. What are the, how to conclude a disease? Symptoms and
History.
history. History means clinical history.
Okay.
Because there may be 2,000 tests. Will you go for 2,000 tests? No. After hearing everything from the patient, you have a conclusion in the mind, which says that this is the disease. No, it is just like choosing something from the 4 brackets. 1, 2, 3, 4, 5. There are 5 diseases which comes to your mind. So now you conclude, oh, above symptoms in number A, oh, this. No, not possible. Number B, not possible. Number C, oh, this disease is relevant to most of the symptoms of this disease comes to number C. So this C number disease, for example, sleep disk, what type of primary diagnosis is there? There are 3 types of diagnosis in sleep disk. Generally CT scan, MRI and X-ray. But X-ray and MRI do not speak much about the patient. What is more important is the MRI. MRI gives the clear manifestation of the disease and you will understand the disease recovers in a better way. Am I clear?
Yes, sir.
Then you can understand what is the status of the disc, how much it is compressing, what are the do's, what are the don'ts, whether it is a surgical case, whether it can be managed. In 70% of the patient, pain can be managed in a beautiful way. And in 30% of the cases, pain cannot be managed in a through any other procedure. It requires surgery. Post-surgery also the pain is there, which you can recover very well. without painkillers. Am I clear?
Yeah.
Am I not clear in any of the points which I am speaking? Do you have
Sir,
any doubts on what am I speaking?
so one
Clear,
thing,
sir. It is very nice.
sir, when we done with the MRI, that time we come to know it's a lesion or only compress the nerve. We can come to
See,
know,
this
right?
lesion is different and surgery, tumor lesion is different, or myelopathy, myelomycia, transverse myelitis. All these are the things which we must conclude. We cannot say that it is a sleep disk on the first go, right? The symptoms of many diseases are same, but if we don't confirm the diagnosis and treat the patient, and later on we come to know that the patient was suffering from transverse myelitis and his symptoms is aggravated after your treatment, then it comes under medical negligence. That because you did not have the proper knowledge of the subject, you treated the patient, and because of the treatment of the patient, which you thought to be simple back pain, later on it was come to known as transverse myelitis, because of which he lost his lower limbs. You may be liable in the any court of law, whether it is Philippines, whether it is India, whether it is Indonesia, or whether it is Malaysia. Diagnosis is most important. Whether it is allopathic doctor or a homeopathy doctor, Ayurvedic doctor, every person who encounters a disease must give the diagnosis of the disease, and then as per the diagnosis, if he gives the treatment, and by chance something goes wrong, he has a safeguard saying that this is the applicable treatment for this disease, and if the patient has gone something for this, he is not responsible. But if you do not identify the cause of his death, then it becomes a medical negligence, and you may have in army court martial proceedings, or your rank demotion, or any such thing can happen to the person. Am I clear to it?
Yes, sir. Exactly.
Sir, good evening, sir.
Please tell me, sir.
Sir, how to read this MRI report, sir? We will be.
That I will really teach you. It is very important. Different symptoms of MRI, different diseases in MRI, transverse myelitis, all this is how to study different images. We will teach you in clinical diagnosis. Right?
Thank you. Thank
you. You may ask me your questions. Any person who is not able to understand me, any part of my language, any paragraph which you are not able to understand, please speak to me so that I can make you understand what you are not able to understand. These are introductory classes. These are not the paid classes. These are not paid classes. This is just to make you understand in a vast way how do you understand pain. Because always I see that you try to just ask a point, then you say this point, that point, without understanding what is pain, what is understanding of pain. You just treat the pain, and in many cases you complicate the disease. As a result, patient suffer for his whole life. Am I right?
सर
हाँ
तो हिंदी में भी रिपीट कर देना बाद में
हाँ, मैं 9 बजे के बाद 10 मिनट के बाद हिंदी में रिपीट करेगा. हाँ
Sir, Dr. Mithun here. Doctor, hello.
Someone is putting something. See,
सर
रतन लाल जी
हेलो
म्यूट कीजिए. सारे गामा पाको म्यूट कीजिए रतन लाल जी.
हाँ सर.
हाँ, सारे गामा पाको म्यूट कीजिए.
Doctor, how to identify psychological pain and traumatic pain, and how to assess and diagnose those pains and treat.
Okay, I'll explain you about various stages of pain, right? So we'll divide it into chronic pain. Chronic pain is divided into chronic widespread pain. What it is defined as? Chronic widespread pain. It is defined as chronic. The pain is spread to a larger region. It is called chronic widespread pain. Then chronic regional pain syndrome, CRPS, chronic regional pain syndrome. What it is called? CRPS, chronic regional pain syndrome. Chronic primary headache or orofacial pain. Orofacial pain. Chronic primary headache or orofacial pain. Chronic pain with musculoskeletal. Chronic musculoskeletal pain. CHMSK pain. We call it CH in short form. Chronic means CH. And MSK, musculoskeletal pain. These are the chronic primary types of pain. Now you will see chronic cancer related pain. What are they? Chronic post-surgical traumatic pain. After surgery, you will see lot of pain in a patient. It is called chronic post-surgical cancerous pain. Chronic neuropathic pain, we already told you, the injury of the pain, it may be in cancerous, non-cancerous, CIDP, it is demyelinating neuropathy, myelinating neuropathy. Other problems are there, which classifies it as pain. Right? Chronic secondary headache or orofacial pain, chronic secondary and visceral pain, and chronic musculoskeletal pain. So here we can understand chronic widespread pain. Now, if you see about chronic widespread pain, it starts from here and it goes up to the whole body, especially in metastasis stage of cancer, met stage of cancer. So we can understand that this type of diseases are very difficult to understand until pain has a definite diagnosis. But when we come to acupuncture and all, we always believe in tongue and pulse diagnosis or this diagnosis. This diagnosis is also called as a clinical symptom, clinical diagnosis. What it is called? Clinical diagnosis. Based on clinical diagnosis, we cannot confirm about a disease. Right? Confirmation of a disease comes only with the help of the investigation. Because once the investigation is in your hand and everything is there, no one can challenge your diagnosis. And then as per the diagnosis, you can decide which kind of treatment has to be done for the patient. You are capable to treat or you are non-capable to treat. Whether 10 method, Tung method or any other method is capable to treat the patient or not.
लिंक भेजा मैंने मैसेज भेजा है
Am I clear?
इसमें एक व्हाट्सएप ग्रुप की लिंक है
No,
और
sir.
एक लिंक है
You said we
टेलीग्राम ग्रुप
cannot
की
confirm the disease with
और
clinical
एक आपको ऐप
diagnosis. So,
डाउनलोड करना है
how
Yeah,
can
you
we
cannot confirm the
diagnosis?
disease with the clinical diagnosis. But
पहले
with
तो आपको दोनों ग्रुप
diagnostic,
ज्वाइन करो इंफॉर्मेशन चाहिए तो
radiology and
इंफॉर्मेशन की कोई
pathology,
जरूरत नहीं है ग्रुप
you
फालतू
can
बढ़ाना नहीं है
confirm
ग्रुप मत ज्वाइन करो आप ऐप डाउनलोड कर लो
the disease. So radiology and clinical both has, because in all the radiological investigation they say that please see it clinically. So the radiology is also a type of advice, and then you have to mix up with the clinical symptoms. That this disease is having so many symptoms,
अब कल
and
10-11
these
बजे
symptoms
फोन
are
करता हूँ ना
are there in this disease or not. So always it is written in all the reports that please apply clinically. Please go. What if you see in MRI? What it is written? please go clinically. Understand? So your clinical knowledge and your diagnostics knowledge should be very clear in treating a type of pain management, because you are treating a tumor, you are treating a cancer, you are treating a gallbladder stone polyposis, you are treating appendicitis, you might be treating a sepsis, you may be treating a UTI infection, you may be treating a tumor, you may be treating a benign tumor, you may be treating a very simple musculoskeletal pain. All this is there, but until or unless you confirm yourself with a diagnosis, you should not go ahead with that. And then you must understand that treating a disease with a proper management only is the recovery, the procedure of recovery. And then in this procedure of recovery, we can understand that the disease can be sorted out. Just, I have seen a patient, people say central pontine myelinosis can never be recovered. I say that CPM, which is a hindbrain, what you call, because of hyponatremia, this type of patient becomes do not recover. Tomorrow I am going to show you the video. A patient who was fought from coma stage, tracheostomy, rice tube. Now he started speaking, he has started walking, and very shortly, within few months, you will see he will be going to office. But up to that effort, we have to put a definite effort. When I used to lift the leg, my hands used to be very painful. And today we see 60%, 40% of the movements of the patient has come. His hip joints, elbow joints, all this has been started flexible. So even if we conclude that central pontine myelinosis, the very good hospital called City Neuro Hospital of Hyderabad, which is one of the best neuro hospital, they said that the patient cannot recover. But now my question is, what is the status of the patient? He may rectify and he may see. Only the problem with us is that we follow the statement of others without having our own knowledge, without having regular study, without managing the regular manifestation. We find that patient is having a problem and we cannot conclude it, and the patient is suffering from a difficult disease. Am I right or wrong? And he is not able to cure. It is never like this. We have to put a definite effort. We have recovered large number of coma patients. We have recovered large number of critical cases. Yes, we do not touch the ventilator patient because in ventilation, the chances of recovery is very less. Post-ventilation patient, we have revived and we have seen patients have recovered. Gradually, we can win over the tracheostomy. We can win over various situations, and I am sure patient can do very well in a good period of time. Right? You may ask me a question and then I'll speak in Hindi.
Sir.
Yes, I'm hearing you, please. Those who want to speak to me in Hindi, they may speak to me in Hindi. Those who want to speak to me in English, they may speak to me in English.
Can we use magnets in tongue acupuncture?
Yeah, definitely you can use magnets in tongue acupuncture. No problem.
Thank you, sir.
Thank you so much, sir. More questions, please. Are you able to understand what am I speaking, or you are just going flat in your mind? Are you able to understand what I am speaking? आप समझ पा रहे हैं मैं क्या बोल रहा हूँ?
Yes.
Only one yes. What about others?
Yes, sir.
Yes, sir.
सर सब समझ पा रहे हैं लेकिन इंग्लिश में शुरू कीजिए.
Yes, sir, we understand.
इंग्लिश में क्वेश्चन.
Sir, your expression is very nice, simple and slowly you are speaking. It is very nice, sir.
You are able to understand what I am speaking, or it is going over your head?
Yeah.
Yes, sir.
Very nice.
We
In
understand.
simple language.
Very good. Very nice.
We appreciate to
See,
have the
before
handout as well.
See, anything before we teach about the treatment protocols, anything we want to teach, anything we have to speak in elaboration, we must give a foundation to it, right?
Yeah.
Walid, before we conclude
Yeah,
the class, can you go
Thank
to
you.
my Facebook and see, today we have recovered a paralysis patient in just 60% recovery of paralysis patient. You can see has been done in few minutes. Can you go to my Facebook, Walid?
Yeah.
Walid? Walid. Assalamu alaikum, Walid.
Wa alaikum salam wa rahmatullahi wa barakatuh, Sastri ji. I'm waiting for the page.
So, Wahe Rahmatullah, Wahe Barakatuh. May I request you to put it? And someone's noise is very high. Please reduce the voice. Yeah, this patient. Can you please put the video of this patient? Suffering from paralysis since last 2016. ये 2016 से paralysis से suffer is suffering from 2016 in paralysis with high brain hemorrhage. You see a patient suffering from paralysis since 2016. Here you can see paralysis due to what impact in the right coronary radiata, internal capsule and capsulogonic regions with subsequently hypotensive. So here you can see patient is suffering from last 2016. He has undergone many treatment. Patient 2016 से paralysis से सफर कर रहा है. It was a large stroke. अब वहाँ gliosis बन चुका है. You can see the image of gliosis over here. You could see gliosis formation over here. And the infarct over here you can see left ganglion region has been affected. Right coronary radiata internal capsular region has been affected, and as a result he has been suffering continuously from paralysis for a long time. इनका ब्रेन काफी डैमेज हो चुका है and 2016 से ये पैरालिसिस से सफर कर रहे हैं. Now you can see within one day can we bring some relief to the patient? That is more important. His upper limb is more affected since 2016. He has undergone through massage therapy. As per rule, massage therapy is prohibited. मालिश कराना पैरालिसिस में निषेध माना गया है. इसको पैरालिसिस को नहीं कराना चाहिए. Now you can see how I am treating the patient of this kind. आपको घबराने की जरूरत नहीं है, हाँ? और कुछ भी नहीं है. उनका हाथ पकड़ने से क्या होगा? हो गया. क्या हो गया? क्या हुआ बताइए? फिनिश. हाँ, अब देखो बाबू, हाथ का देखो क्या पोजीशन है. अब देखो बाइसेप में कितना आया है पावर. Now you can see it has come 3 places and the spasticity was there, has been broken. It was grade 1. Now you can see it has come to grade 3. Now you can see the patient is having grade 3. This patient was suffering from paralysis. She is suffering from 2016. People say after 6 months of the recovery becomes slow. but here you can see the recovery is very good.
अब वो
Now
काफ
you can
लगा के
see
देखिए.
we are putting the calf of 1 or 2 kgs.
फिजियोथेरेपी घर पर आकर फिजियोथेरेपी करता था सर.
घर पे नहीं, आपने हाथ में 1 किलो का बांध के कुछ किया?
ये हाथ से बांध के नहीं किया, पैर पे बांध के किया.
नहीं, हाथ पे
नहीं किया, पैर पे बांध.
So you are saying that upper limb recovery is difficult, but in this case you can see they are recovering you on the spot, upper limb recovery.
Now you see how much you can see the stimulation.
Yes.
देखिए ग्रेड 1 से ग्रेड 4 आ गया.
So the power was grade 1. Now you can see the power has come to grade
अब 2
4.
kg का बांध के देखो बाबू.
This is advanced brain
Now
stimulation,
we are taking a
and
wet
the
cup of
patient
1
has recovered
kg. Now
instantly
we are
on the
going to
table.
put 2 kg. Now you can see his spasticity has gone by more than 70%. आपके पैर को नॉर्मल कर देते हैं ताकि आप आराम से चल सकते हैं. ट्राइसेप्स देखो बाबू, ट्राइसेप्स.
Now if you integrated this technique with your physiotherapy, with your traditional techniques, you see how good results you get in a patient.
ट्राइसेप्स से ग्रेड 4 आ गए, नॉर्मल आ गए. हाँ, अब आपके मैं पैर को ठीक कर देता हूँ ताकि आप आराम से सीढ़ी चढ़ सकते हैं.
See, I am not using any acupuncture point. It is called non-invasive brain
आगे सीढ़ी चढ़
stimulation
सकते
that I
हैं.
will teach you.
सपोर्ट लेके ना इंडिपेंडेंट. अभी आप बिना सपोर्ट के आराम से चल पाएंगे. क्या हुआ बताइए.
अभी निकाल कैसे.
आप अगर ऐसे करेंगे तो आप ठीक होना है या नहीं होना है. ठीक होना है या मैं छोड़ दूं.
So you see how we do the counseling of the patient.
ठीक होना है.
यस सर.
कितना दर्द हो रहा बताइए.
थोड़ा सा.
तो फिर आप उतना.
Now the patient is saying the incessant pain is very little. He was fearful at the beginning. Now he is convinced, and it is his first session. You can see how beautifully he can recover. Second part is to sustain the
ऐसे कर रहे जैसे कि बहुत बड़ा प्रोसीजर हो रहा हो. हो गया. पाँव का देखिए सारा मसल स्टेबल हो गया.
थोड़ा सा ऊपर की तरफ जाइए. इसको अंदर की तरफ लेना पैर को. नो.
Now you can see upper limb has become totally stable from grade 2 to grade 4.
आउटसाइड ले जाओ.
And this is the treatment which I have done after 6 years of paralysis. So the myth behind this, एक विश्वास है कि 6 साल बाद पैरालिसिस ठीक नहीं होता. आज आप समझ सकते हैं 6 साल बाद भी पेशेंट को बहुत अच्छी रिकवरी मिल सकती है, प्रोवाइडेड आपका पाथवे, आपका तरीका सही हो.
नीचे दबाओ मेरा हाथ. नीचे दबाइए हाथ.
अब आप बिना सपोर्ट के चल सकते हैं. इनको बैठा के देखो हाथ का कितना वो आ गया.
Now you can climb staircases also with very mild support. You can see the patient is now independently standing.
देखिए हाथ आपका सीधा हो गया. आप ऐसे होके आए थे ना. अब नाक तक लगाइए. ऊपर ले जाइए.
You can see the spasticity has gone to a greater extent with
4 साल में और
without
अब में
Botox.
कितना डिफरेंस है?
After 6 years of
कितना
stroke.
फर्क आ गया? 40 के 70% आ गया। देखो आप सारे मूवमेंट आ रहे हैं, आप लगाओ, करो, ऊपर टेस्ट करो। हाँ, नाक को लगाओ, उधर ले जाओ, राइट, ऊपर,
This is a the patient is a 6-year-old stroke patient.
कितना रिकवर हो गया आप?
70%
हो गया। 2016 से अभी तक क्या कर रहे थे आप? 2016 से आज कितना साल हो गया?
सर हम लोग कोई 10 लाख बोला, 10 जगह एड्रेस हम लोग ट्राई करें, अच्छा होगा, वहाँ अच्छा होगा, उनका इसी का
कोई डॉक्टर कहाँ एड्रेस दिए वहाँ पर जा रहे तुम लोग?
2016 से लेके आज कितने साल हो गए? 6 साल हो गए। 6 साल आपने ऐसे बर्बाद कर दिया। 10 मिनट का काम नहीं। पूरे दिन ट्रीटमेंट कीजिए ठीक से, स्टेम सेल थेरेपी ये सब कीजिए, पेशेंट वाकई में काफी इम्प्रूव हो जाएगा। और थोड़ा फिजियोथेरेपी सब करेंगे। कितना बजे का टाइम देगा इनको? 12-1 बजे। 12-1 बजे आप आ जाइए। 1 घंटा का 1.5 घंटा का ट्रीटमेंट रहेगा। 2 महीने में इंशाल्लाह काफी इम्प्रूव हो जाएंगे।
Within 24 patient sessions, patient will recover up to
रिकवर हो जाएगा। पैरालिसिस कोई बहुत बड़ी
In this case,
5 साल नहीं लगते। It does not treat this patient is suffering from last 5 years. It does not take 5 years to recover a disease. You could see अभी ट्रीटमेंट करने के बाद आपको कितना फायदा हुआ?
बहुत अच्छा फायदा हुआ।
कितना?
70% फायदा हुआ।
आगे आपको इतना फायदा हुआ था?
नहीं हुआ था सर।
आपको लगा था कि आज एक ही दिन में 70% फायदा होगा?
नहीं लगा।
आप क्या सोचे?
I asked the patient whether he will recover 70% in a single day. He said, "No, I don't believe it."
आपके कमेंट्स में पढ़कर में आया।
हाँ,
जो पेशेंट को आप लोग हेल्प कर रहे हैं।
अभी तो आपका वीडियो भी जाएगा।
हाँ, कोई बात नहीं सर।
अब बताइए, पेशेंट लोग को बताइए आपको कैसा लगा उधर से?
हम लोग को यकीन था कि इतना होगा,
हाँ,
इतना काम करेगा बोल के पता नहीं।
पेशेंट को पूछो क्या लगा था, कैसा लग रहा है, और पेशेंट को क्या एडवाइस देंगे?
बहुत अच्छा लग रहा है शास्त्री सर पास आकर। आप भी पैरालिसिस पेशेंट जो भी है आकर इनसे एक बार कंफर्म मिलिए। बहुत अच्छे डॉक्टर साहब हैं।
रिकवरी आ जाती है? इतना सोचा था एक मिनट में आ जाएगी?
नहीं सोचा था, मैं कभी नहीं सोचा था कि इतना रिकवरी आएगा।
नहीं सोचा था?
नहीं सोचा था।
5 साल और एक आज का ट्रीटमेंट कितना?
सर हम बच्चे नहीं मिले जब सर आपका पता
थोड़े दिन में ये फिंगर्स का मूवमेंट ये सब भी आ जाएगा। उसके बाद आप घर पे कर सकते हैं, एंड देन यू रिकवर इन ए better way. So here you can see a patient who was suffering from stroke from last 2016, paralytic patient, has recovered almost significant level by 70%. अब आप चल के देख सकते हैं, सीढ़ी आप इंडिपेंडेंटली उठ सकते हैं।
You can see this video in detail in the Facebook. It is already uploaded. Thank you so much. You may close the video.
ऊपर चलिए।
Close this one. Close this. Close the Facebook. Hakim, close your my. You may ask me your questions and then we'll conclude the class. देखिए, मैं आपको हिंदी में बताता हूँ। पेन का स्टेज होता है। पहले सबसे बड़ी बात होती है उसकी हिस्ट्री, कि किस तरह से जन्म हुआ, आपको किस तरह से पेन महसूस हुआ, अब आपको किस तरह से लगता है, और आपको अब क्या महसूस होता है। उस आपकी जो एक्सपीरियंस है उसके बेसिस पर हम एक अपने मन में कंक्लूजन डेराइव करते हैं कि ये एक बीमारी हो सकती है। उस बीमारी के अनुसार हम कुछ एक डायग्नोसिस लिखते हैं, बिकॉज आज के दिन में विदाउट मेडिकल डॉक्यूमेंटेशन अगर हम किसी बीमारी का इलाज करें और कुछ और निकल जाए तो वो मेडिकल नेग्लिजेंसी का कारण बन जा सकता है और हमें जेल हो सकती है। इसलिए डॉक्यूमेंट्री एविडेंस ऑफ एवरी डिजीज इज इम्पोर्टेंट, नंबर 1। और दूसरी बात ये है डिजीज को समझने के लिए उसके सिम्टम्स को जानना जरूरी है। कौन सी बीमारी के क्या सिम्टम्स है उसको जानने से Just mute the mic. Now you can see there are two things we must understand: diagnosis, symptoms. हमें तीन चीज के समझना है। रोग के जो सिम्टम्स होते हैं उसके बारे में समझना है, जिससे हम एक कंक्लूजन निकाल सकते हैं, which is called clinical diagnosis, and then we can confirm it with the pathological and radiological diagnosis. यानी एक्सरे, एमआरआई, ब्लड टेस्ट से हम कंफर्म कर सकते हैं इस आदमी को ये बीमारी हो सकती है। उसके अनुसार जो बीमारी है, जिस तरह की बीमारी है, उसके उस अनुसार ट्रीटमेंट कर सकते हैं। पर प्राइमरी लेवल पर अगर पेशेंट आपके पास सीवियर पेन में आया है तो आप एक्यूपंक्चर सबको यूज करके उसका पेन रिड्यूस कीजिए। साइड बाय साइड मेडिसिन के साथ अपना ट्रीटमेंट चलाइए। पेशेंट विल फील बेटर, क्विक रिकवरी, बेटर रिकवरी एंड ए नाइस रिकवरी। बिकॉज कितनी बार पेशेंट का केमोथेरेपी के साथ पैरेलली we apply this type of treatment and we find that patient recovers in a beautiful way. So we can understand, first thing is that after 6 years you were saying patient of paralysis cannot recover. You have seen after 6 years also this patient who came for the first time could see a significant recovery. But now to sustain it, stably and better recovery, we may need some time. But on the table you could see that the patient got more than 70% recovery. He came for the first time. It was the live video and live recording of the patient was done. Unedited version is there. And you can understand कि patient अच्छे से recover हो सकता है। अगर आपको कोई सवाल पूछना हो तो आप पूछ सकते हैं।
Hello, doctor.
Yeah, you can ask me a question, please.
Yes, what's the acupoint for the recovery, sir?
See, I don't use acupuncture. I use my technique on NIBS, non-invasive brain stimulation, which we apply specific type of brain pain. Walid will explain you about this NIBS. You please speak to Walid. You are from Nigeria, na? Walid is my very old coordinator and student. He will teach you much about brain stimulation. You can please learn from him and he will guide you much better way. Right?
Thank you, sir.
Thank you so much. More questions?
Yes, sir.
Yes, please, sir.
Will you teach us this technique, sir, in these classes?
Which technique?
Brain stimulation and paralysis.
This is pain management surgery.
Okay, okay.
I'm just telling you one small example, which I came to know that after 6 years, paralysis patient cannot recover. He has stopped taking physiotherapy from last 3 years because there was no recovery for 2 years. And then today when he came to my class session, we showed him recovery. And then after we followed up with physiotherapy, we'll follow up and everything. Then we will say that the patient can recover.
Okay, thank you, sir.
But initially, in paralysis, we want to show only one example that even after 6 years, 7 years, if there is a scope, patient can what?
Recover.
Yeah, you can see his hand movements. Did you see his hand movements? His hands were totally stiff. He could not move it like this. Like this, you see? His hands were like this. He could not move it like this. We also did not think that he will move on the single day. But then we thought that let us try. And patient was very fearful. If you put a needle, आप किसी के माथे में needle लगाएंगे तो सबसे पहला चीज क्या लगेगा? उसको सबसे ज्यादा डर लगेगा. Patient was so fearful in the first session. हमें ऐसा डर लग रहा था he will run away. But you see, patient ने थोड़ा सा patience रखा, उसके wife ने थोड़ा सा support किया, बाकी लोगों ने, मेरे जो बाकी patient थे उन्होंने counseling की, 10 मिनट दिया and you could see revival is there. But this revival has to go into sustenance level of recovery.
Doctor,
Am I right?
this
इस बीमारी paralysis को आप sustain करना है.
Yes, sir.
Doctor,
It is just one step. It is not the end of the journey. You have to sustain, improve, and bring a better recovery for his whole life.
Doctor, this NIBS technique
Okay, thank you, sir.
only on scalp, only you are putting the needle on the scalp for NIBS technique.
See, scalp means what? Non-invasive brain stimulation. It can be done by sensory pathway, putting needles in different areas of the body, as well as also in the scalp. Motor scalp stimulation gives immediate recovery in what? Motor movements of the patient, because there was no sensory deficit in the patient. So we saw that there was no sensory deficit and there was spasticity. We thought that this stimulation may revive the spasticity, and we found that the spasticity was immediately gone and the movements were resumed. इनकी spasticity reduce हो गई थी. 6 साल पुराना पैरालिसिस था. आप देख सकते हैं कितनी सुंदर से रिकवर हो गया विदाउट एनी कॉम्प्लिकेटेड प्रोसीजर. बट अब इसको ठीक से स्टेबल करने के लिए, सब कुछ करने के लिए, इसकी आंगली को खोलना, रिस्ट ड्रॉप को खोलना एक लंबा चैलेंज है. उसके पीछे लगना होगा और तकरीबन कुछ समय के बाद पेशेंट आपकी तरह मेरी तरह काफी स्वस्थ हो जाएगा. My only saying is that he wasted 6 years. If 6 years could, if we all have learned good techniques and could master good techniques, then his 6 years of his life would have not been wasted. Today his career would have been totally different and his family would have been totally different. Am I right?
Okay, so you will teach us this technique in the coming class, this brain.
Yeah, in paralysis method, I will teach you these techniques.
Okay, thank you.
More questions?
Very
Any
clear,
more
sir.
questions?
You are teaching very well.
Acha, now I am asking you one small questions. Are you able to understand what I am speaking?
Yes, sir.
Yes, sir.
Or it is going above your head? Because I am teaching you without any PPT. I am trying to teach you because I am trying to learn a new habit of teaching, because whatever is written in the PPT has a limited knowledge. So when we teach a people with a wide, different level of knowledge, different areas of people from different countries of different atmosphere, then we should not use much of the PPT. We should see the mood of the people and we should try to lower down the knowledge from Z to higher level to the lower level where you can understand. यानी ऊपर से मुझे नीचे आना है ताकि आप मेरी बात को समझ सकें. Am I clear?
Yes. Yes, sir.
See, these are the foundation classes which you should understand very well. These are not the paid classes, right? These are not the paid classes. कोई भी सब्जेक्ट को समझने से पहले, before you understand any subject, you must understand the foundation of the subject, terminologies of the subject, so that when you treat the patient, the concept of treating the patient should be clear in your mind, right?
Okay.
Yes, tell me.
Sir, could you brush us up on the instruments and the needles used and the
Needles are simple needles.
inserted?
This pen is made by ourselves. Avinash also is using, I am also using, and we are getting, because this is a calibrated pen. You have to calibrate this pen as per the intensities of the patient, because if you use different types of pen which is found in Chinese market, that may hamper the brain. Brain is very sensitive. You cannot say, for example, if I say you, "Oh, you bloody fool, you do not know anything," what will be your expression? Definitely an induced expression. So if you give a wrong signal to the brain, brain will also give you a wrong interpretation.
Yeah,
right?
yeah, interpretation.
Right communication,
Yes.
right interpretation leads to right solution.
Okay.
Am I clear?
Yes, sir. You're clear. Thank you.
Anyone is having any doubt which is not able to understand, please speak. Yeah, you will get all, there is no slides here. You will get the complete video. First video is already given in the group. Second video also again we will be given. And this is the third video. We are just waiting for our license to be upgraded. We never thought we will accept more than 100 people. So once the license is upgraded, we'll give you all the treatment protocols. Right?
Yes.
And then through Facebook, I'll explain. First, I'll make the Facebook videos, and then through Facebook videos, I'll explain you how I have treated the patients, right? But in my clinic, the major problem is I don't get a simple patients. I get most complicated patients on which these techniques cannot be applied. You have to apply the very higher techniques of NIBS, complicated techniques. But anyway, you have seen this patient. This is a complicated technique of brain mapping and stimulation by which you could see immediate recovery of this patient. Sometimes you see instant results, sometimes you see delayed results. It all depends on the situation of the patient, right?
Doctor, one more question.
Yes, Bidun Saab, say, tell me.
Yesterday I saw your website, mksastri.com. In that website, I saw a lot of protocols in Tunga acupuncture only. Is there any protocol in acupuncture, physical acupuncture there? I couldn't see that.
See, we have complied with lot of protocols because some protocols apply in one patient, some do not apply in some patient. So, while writing the notes, you can have lot of protocols. So before giving you the protocol, I'm giving you an introductory class so that while I'm dictating the protocol, one person whose handwriting is good may write it, may record it, and then later on you may make your notes and you can clarify your notes with me, right?
Okay, doctor. Yeah.
I'm more than your what you call as tuition teacher. Today, if you send your children to the tuition, class 1 or class 2 or primary school, they charge more fees than this. And you make me work more than a primary school teacher.
Okay.
I'm more than your primary school teacher. Huh? I have to check your homework. I have to tell you notes, then recheck it, then see whether you are progressing. For how much? 3,000 rupees. Your school teacher and college tuition teacher charges more than me, right?
Yeah.
Anyway, please ask me more questions or else we will conclude the class. I think there are no more questions. Any more questions? Number 1. Any more questions? Number 2. We will have 1 or 2 more introductory class till we get the license for 300 people. We have written them. There is some technical issues from India we are facing. So maybe 1 or 2 days it will be upgraded and then we'll follow up with the classes. One day with that this one and then we'll follow up. But this is very important before you treat the patient because having a knowledge, proper knowledge is not a wastage of time. Doing a good homework is not a wastage of time, but making a mistake and correcting it is a wastage of time. Remember, you are learning a medical knowledge, you are working with a life. There are two things. You may complicate the case and go to jail. You may recover a patient and you may increase your fame and practice. It's up to you what you want to do. You want to do a good homework, please do your good homework. If you don't want to do your good homework, please don't do your good homework. By a good diet, by a good activity, your health will improve and you can see once you will see that you can recover many type of cancerous patients. We have recovered many types of benign tumor patients. We have supported many cancerous patients in the last stage. And those who are not able to be managed in their home, they come over here as a palliative care and we have supported them up to their last time of their life. Clear? Huh?
Okay, yes.
Thank you so much.
Thank you, sir.
If I can be of any good to you, just let me know. Huh? Thank you so much.
Thank you.
Thank you
you
so
so
much,
much.
Doctor.
Thank you, sir.
This video will be broadcasted in all the groups. If anyone still wants to join, they may join. We are waiting for, we have already paid the money. We are waiting for them to upgrade our 300 people, right?
Thank you so much.
Thank you,
Pranam,
sir.
sir.
Thank you.
Pranam,
Pranam.
sir.
Pranam, Ratan
Thank you.
Singh.
Thank you, sir.
Thank you so
Pranam,
much.
sir.
Thank you so much.
Thank you,
Sayonara.
sir.
Thank you so much. Thank you for your kind cooperation.
Thank you,
Wish you all
sir.
good night.
Pranam, sir.
Beautiful night. Pranam, beta. Pranam. Yashashviman, Dirgwan, Putravan, Dhanwan.
Pranam, sir.
यशस्वीवान दीर्घवान पुत्रवान
Good
धनवान
night, sir.
सब
Your
कुछ हो
explanation is
सारी
very good, sir. You there for that? Where is this bag she brought to me? Angela, bring it up, please. That's